Hi, I'm with Miia Rahja, and Miia recently published her paper, which is a case note audit of occupational therapy notes, looking at the evidence-based approaches that we use and occupational therapy care for people with dementia. So welcome, Miia. Can you tell us the main results of your paper?
Sure, thank you, Kate. So basically what we did is we audited 87 case notes of occupational therapists supporting people who live with dementia in the community. And we really just wanted to have a look at what the current service looks like. And so what we found was that services tend to be quite short-term in nature, and with only an average of 2 visits per referral, or 2 consultations per referral. What we found that the most common assessments that occupational therapists commonly use is related to either home safety, falls risk, or function. What we then also found was the most common interventions that occupational therapists use, mainly just referral to other services, home modification advice, and prescribing assistive devices.
Okay, great. So it sounds like there's a lot of potential for us to do more. Yeah. So what do you think are the main implications of your research for readers in their clinical practice?
So I think the main implications really are that there is currently quite a big gap between what's considered evidence-based practice and what we actually are offering for people who live with dementia in the community. So the current interventions we provide don't reflect the interventions that have been tested to be effective or even cost-effective in research trials. So I think it's really I would say a call for action for therapists to really shift their focus from this assessment and risk management to interventions that are really preventative in nature, and they also focus more on supporting caregivers, because that is something that evidences has been really effective. And I think also we need to start really promoting independence for people with dementia and addressing these changed behaviours that they may exhibit.
Yeah. Okay, great. So when you're talking about approaches that have been supported by the evidence, so you're talking about some of the studies by Maud Graf and Laura Gitlin, and some of these community-based studies where they look systematically at people's problems and trying to keep people independent.
That's exactly right. Yeah. So a lot of evidence at the moment says it's these sort of multi-component interventions that consist of at least 4 sessions, up to 10 sessions for a referral, and they really take the systematic approach. They always engage a caregiver and really upskill the caregiver so that they can continue to support their loved one in the community.
Yeah, great. Yeah. Okay, and tell us, so how did you come to get into research? So you're coming to the end of your PhDs. How did you get into research?
That's a good question, Kate. I guess it was quite an organic process and not really something that I had planned to do. So during my undergraduate years, I was offered a position in the honours program, and I chose to do this just to challenge myself a little bit. And while I was completing that, I really enjoyed that the challenges that came with the research, setting up my own project, engaging the people who were involved in a project that I was completing, and then just the rewards that came with publishing a piece of work. Yeah. So following honours, though, I didn't really think much more of it, and I started working clinically as an occupational therapist, and I worked in youth mental health. But after about 18 months of clinical work, I found out about this opportunity to complete a PhD as part of a nationwide implementation project. And when I saw the opportunity, I just thought it's something I really need to be involved in, and I just sort of thought that I'd pursue that a bit further and see what it would entail. And I was really lucky to become part of that project, and that was a couple of years ago. So yeah, nearly finished now.
Great. Yeah. And so tell us, what part of research do you enjoy most, and what challenges you the most?
I think what I enjoy most is just seeing the impact that we can make in people's lives. So I think through the work that I do as well in care of people with dementia, we get to see really what works to make things better for people who actually need help. And also in my area of interest, which is people with dementia and their caregivers, I think I just really enjoy being organised and achieving goals, for myself, but also for them. So, they want to be at home, they want to continue looking after their loved ones and so on. I think one of the things that really challenges me is that research processes can be quite tedious, and you need to have a lot of patience. And it's not, I guess I'm not always very good at it. It's something that I'm learning as I'm going. Yeah.
Thank you very much, Miia.
Thank you.